It's wonderful to see, although I can't actually see many of you here today. And I know that you have had a very full day of learning. And so really, this is the last session of the day. I imagine many of you are kind of tired and have been sitting for a long time. And so really this workshop is to be much more interactive, to break us up into groups for 2 different times during this presentation. I actually don't have a lot that I want to share in terms of content because I think you have received a lot of content today. And I think it's really important for us to have time and space to be able to actually engage with one another about some of the things that we've learned. Now, we've started a little bit late. So originally I was going to have people, put in the chat, and feel free to, if you want to, along the way, just as a way of connection, what do you enjoy most about counseling work and ministry? And you can type your name in there and your country, just so that we know who's here and you can get to know each other. So I'm just going to jump right in so that we can have this time together. In terms of some of the objectives, like I said, I want us to have an interactive space. I'd like to explore just a little bit a theological basis for mental health care's mission, and then to talk about some ideas in clinical work or community and global engagement, and then give you opportunity to share ideas and next steps in groups today. So, first of all, I think we all know this has been said several times today, but with the global pandemic, clearly mental health care is on the forefront of many people's minds. And the WHO, already has statistics out that 1 in 4 people in the world will be developing a mental health condition in their lifetime, and that the number of psychiatrists, especially in low-income countries, is less than 1 for 1 million people. Clearly inadequate resources for the world today. And that's why I think what we're doing in our role in counseling is so important for us to consider and to explore. When I first came into counseling, really I saw my role as I just wanted to do this because I wanted to help people and I wanted to help people find healing. But I really thought of it as, I'm not really doing mission work. Like, that's really for missionaries and pastors and church planters. For me as a counselor, I'll just kind of clear out all the junk, all the stuff out of the way so that other people, like the true missionaries, the true, workers, can come in and then share the gospel and do their evangelism. But in the last years, my understanding of what counseling or mental health as mission has actually changed and shifted. I really like this statement from John Stott out of Lausanne Covenant that we are the whole church taking the whole gospel to the whole world. So important for us to consider what this means in terms of the whole gospel. One of my favorite, and I'm seeing that there are some people in the waiting room and I'm not able to, to admit them. I'm hoping that the other hosts can admit them into the room. Isaiah 61 says that, which is one of my favorite passages when I consider the good work that we do. And I'm not going to read the whole thing, but really that we have been anointed to proclaim good news, right? Good news is the gospel. And how does Isaiah define the gospel? It's binding up the brokenhearted. It's proclaiming freedom. It's releasing from darkness for the prisoners. It's comforting those who mourn. It's helping to provide for those who are grieving. And it's seeing beauty come out of ashes. If that's not a description of the counseling that we do, I don't know what else better describes that. And the end of Isaiah 61 says that really the purpose of all this, right, as all of this happens, is that the Lord will make righteousness and praise spring up before all nations. Like, he uses this kind of care for people, this kind of ministry to people, to actually bring up his praise before all the nations of the world. To me, that is a vision that I can hold on to in our counseling. We see that Jesus uses this exact same passage at the beginning of his ministry, where he stands up in the synagogue, he reads this very passage, and he says, today the scripture has been fulfilled in him. And, we know that as he went about ministry, that he was actually not just proclaiming the good news, bringing people to himself, but he was healing all kinds of diseases and sicknesses. And I don't think that was just physical. We know that you can't just separate and compartmentalize those things. We are whole people, and that all of it gets impacted. So as Jesus went around the earth in his 3 years of ministry, he was committed to the healing of people. And that was across cultures, that was across social strata, that was across different religious persuasions, and people who weren't, quote unquote, living according to kind of the moral choices, right? He made that accessible for all. And I think sometimes we look at the gospel as this very one-dimensional thing, that it's kind of our purpose for the gospel is to get people into heaven. And I sometimes think that we as counselors, we sometimes think that that's our goal of Christian counseling, is we're just trying to get them, into our sessions so that we can just share the gospel and get them into heaven. But the gospel is a much more whole view than that. And it really has to do with shalom. A Filipino theologian, Al Tizan, and he's also a missiologist, he says this about the biblical vision of shalom. It is God's very best, restoring and reconciling the world to how God intended it to be, right? That the church is called to live out the whole gospel, the gospel of the shalom kingdom. And that means it's reconciliation between God and us, people and people, and then between God, people, and creation. It's a whole view of what wholeness and reconciliation means. This is the gospel that we are to preach and nothing less. This is a vision of shalom. And when you think about the word shalom, right, it's defined in lots of different ways. He describes it as reconciling the world to how God intended it to be. We hear the word peace or flourishing or wholeness. And when you think about the work that we do in counseling, we actually address those obstacles to shalom in our clients' lives, in the people that we serve, right? When you think about what stands in the way, why are people stuck in the different places of their lives, right? They are stuck in spiritual, emotional, relational, and psychological issues. These are the very things that we get to address with people in our sessions, in our times with them, over coffee, whatever the ways and contexts in which you minister to people with counseling. This is what we do. We remove obstacles to people experiencing the wholeness of God in their lives. And I don't know, but what better way as followers of Jesus, where this is really represented in Scripture as the greatest commandment and the Great Commission, right? The greatest commandment is that we are to love God, right? Wholeness with God, love others, right? Wholeness with people, and then loving ourselves, taking the broken, wounded parts of us and bringing them together in hope, with hope and healing, that wholeness, right? That's our client struggles. And our counseling role is to help people to be able to more fully live out the greatest commandment in their lives. That's what we do. We don't need to wait for church planters and pastors to come in and help others live out the greatest commandment. We actually do that in our counseling. And as people are healing from that, they go into the world, right? They have impact in the world to be able to influence the world for Christ, is for his kingdom, right? And as they live in that, they experience, hopefully our healing presence in the world, right? We talk about hurt people, but healed people, heal people. And that's part of our role. We're helping people to live in the world as light and salt that bring healing, hopefully not pain and suffering, more pain and suffering to those that are there. And it's synergistic. It's as they live in the world, they encounter struggles again, and they come back and receive more healing and counseling, and they go back into the world. And this is the privilege that we have with our clients and the people we serve. I can't think of any other profession in the world that allows us to have such access into the deepest places of people's lives. I've often heard people say to me, "You are the first person I've ever shared this with," right? I've never told anybody this. That people come into our office and are vulnerable. They tell us these things that they would never tell other human beings, because we create that safe and confidential space for others. And when people feel safe and they know there's confidentiality, they can finally reveal, they can put their walls down and reveal themselves to us. And then we are able to come alongside them to take them to those places from brokenness to wholeness. That's what we're called to do. We're called to counsel and we're called to mission, because the mission of God is to see wholeness in the world. And so really one of my things that I just love about counseling is it is such a sacred work, right? That when we are sitting with people, right, in their vulnerability, in their pain and suffering, oftentimes the only person, right, the only person to really value them, to love them as they are, not saying you need to be here, you need to be there, but how you are right now, I accept you and love you and want to be beside you in this. This is incarnational work, right? We actually get to be Jesus with skin on. That people often have these blocks with Jesus, with God, spiritually. They see God as this judge or somebody that's there to punish them. And as we are incarnational, as we embody the presence of Jesus in our counseling with people, we actually help them experience God in new and healing ways. It's his presence in us, right? And as we love and accept our clients and those we serve, they actually oftentimes can get unstuck in their view of God because they actually have a human person who is expressing the character of God to them in the kind of care that we offer in counseling. So, to me, this work of counseling is truly sacred. And I think it's important for us as counselors not to just see ourselves as just on the sideline of the mission of God. We are the very central and important role in what we do. And it's really important that as we consider the work that we do, that it's not just a job, it's not just a career, it's actually something that we are committed to, that we come into our offices and our spaces of ministry with that kind of vision and mission. I am here to be the presence of Jesus, to be missional in my work, and to be faithful and excellent as a counselor in what I do, in order for people to experience that shalom, that peace of God with him, with others, within themselves. That is the work of counseling. So what I'd like for us to do is I'd like to break us up into rooms, because really this is about you all having a chance to talk with each other. What do you think about this? How do you see counseling as the gospel of Shalom? What examples do you have just in your own ministry, in your own counseling, where you have seen this at work? So I want us to we're going to break you up into groups of about 4 and give you about 10 minutes to just share with each other and to engage with a little bit with this principle of being called to counsel and called to mission. So I will see you all back in about 10 minutes and we'll move on to the second part of this presentation. Okay, well, welcome back. Welcome back, everybody. I wish we had more time together to be able to share. I'm sorry, some of you probably got cut out, but let me just keep moving with time. I'm going to keep moving with time. So, we've talked about, us as counselors individually, right? How we can be missional in terms of how the role of counseling is a missional role in terms of expressing and demonstrating the gospel healing of shalom, wholeness into the lives of our clients. But it doesn't just stop there, right? That it's within our offices that we go from there, into, right, you shall be my witnesses into Jerusalem, Judea, Samaria, to the ends of the earth. I think about concentric circles, right? So from our offices into the community and into the world, that's really what our role is, not just one-to-one, but how do we step then beyond our walls as well? I think it's really important when we think about local community, and we've had some great talks already. Think about Dr. Gingrich's strategies on that this morning, and others I'm sure that you've heard even in the workshops. But how do we move into our community, right, in terms of bridging, especially the local church and the local community with mental health? And each of you come from different contexts that are different in terms of how that looks. Sometimes local churches don't feel that great, or they're not that positive about mental health care or counseling. So how do you form bridges there? What steps do you need to take? Another important part of that is that I think sometimes we can come into communities and say, this is what you need. Let me tell you what you need. And instead, it's so important to go into our communities to listen with humility, listening to our pastors, listening to our community leaders, to really understand what is a local context needs. That's so important for us, especially those who are professionals who tend to kind of think we know what's best for you, right? We have to be careful about that and be our humility. And the other thing that was talked about today too is how do we increase awareness and education of the different mental health issues about suicide, depression, anxiety, parenting. There's so many issues that are very practical and meaningful for all people, everyday people, right? And then also, how do you partner with professional counseling community, right? Who are the local psychiatrists? They don't all have to be Christian, right? Who are in the secular community? Who can you be joining with on events? And for example, like at Cornerstone, a couple of years ago, we held kind of our first mental health fair where we invited the whole community, and we invited 5 panelists, local psychiatrists, EMDR specialists. We had a mother-daughter who had struggled with some mental health issues. We had a local professor, psychology professor from the university. We had a panel discussion on suicide risk and depression, and we talked about it as a community. And that really was a wonderful event for us to learn more about what's going on and how we can better address that. So there might be other ideas as well. And then beyond the local community, global involvement. How do you respond to global crises like COVID? I know Dr. Ang did a workshop today on just that very thing about crisis response, or networking with other communities and resources like the ACCA. For those of you who live in countries where you haven't come together as an association to really collaborate with one another, maybe considering how could your country network and form groups in order to work together instead of isolated in different parts. Financial and human resources. At Cornerstone, we started to set aside 10% of our income would go specifically towards community and global health. That's what we decided to do as a tithe concept. So we always knew we could give towards the community and towards global initiatives. And then another one is, how do we support those under-resourced communities? In Thailand, we have farther villages that really don't have access to mental health care. So sometimes we have traveled to those farther villages to do workshops and to do trainings in trauma healing, or on depression, or on emotional awareness. Hosting these kinds of workshops in local contexts that are far outside the places that normally have access. There might be other ideas that you have. I'm sorry, I'm running through this really quickly, but I know that there's a wealth of information just on the people on this call right now. I think I want to really just stress here as we kind of move into this next part of the discussion is that we have to do this together. We are the body of Christ, right? So instead of trying to do it individually or in isolation, I want to encourage us, could you gather together some like-minded colleagues and begin to brainstorm, to begin to pray and say, God, open our eyes to see, where are you at work already around us? Where is the Spirit already kind of moving with energy around us? And how can we join you in those efforts already? It's so important for us to be discerning, to have our eyes of discernment open and attentive to what He's doing in the world, and especially in our local communities. And the third thing is, we have to be willing to experiment, to just try some new ideas. If we always stay safe with what we've always done all the time, but experiment, take some risks, and think creatively. Just start with something small. Say, you know what, I'm gonna going to host a workshop. Let's just try it and see what happens. See who comes, see who might be interested. Just those steps of faith, God will honor and give even more opportunity. And we have seen that happen in Thailand, and especially at Cornerstone, of God honoring steps of risk and faith to try new things. So again, I know that you have some ideas even in this group, and I want to give you one more chance. And I'm looking at the time, and I think let's just do like 6 minutes. Okay, 6 minutes. Let's just share some ideas. What have you done already? What are some ideas that you might have for your local community, just from what you've heard so far in this conference? So it says 10 minutes on this slide, but I'm going to give you 6 minutes. Let's break up into those groups of 4. They might be different people, but just jump right in to say, here's some thoughts, ideas, here's what we've done, to be able to collaborate and share this with each other. So I'll see you in just a few minutes. All right, well, we just have a few minutes left, and we are finishing up here. I hope that you've had some good discussions. Again, really wanting you to have time to engage with one another and to share some ideas with each other. Just in closing, I think I'm going to repeat myself, but really we are called, right, to have a renewed vision of the role of the counselor and the responsibility, and that comes with that work, especially in just the approach to not just a one-dimensional view of the gospel, but a more whole view of the gospel of Shalom. And that means that we also have to be competent, right? We don't do this casually, that we have to be committed to excellence and to cross-cultural development that's patterned after Jesus in the way that he interacted while he was here on earth, healing, proclaiming good news, binding up the brokenhearted, all that Isaiah talks about. And then lastly, community, local and global, that our mission is not just within our offices or over the table or desk, but it goes out beyond our 4 walls into our local community, into the world, interdependently, collaboratively, and ultimately with humility. So where are you going to join God in what he is already doing? He is at work around you through counseling as mission into the world. And I want to encourage you to just open your eyes to what he's doing and to join him there. So that's really the presentation. I hope that it was more about you having time with each other and to be able to share with one another. So I don't know if there are any questions. I'm going to look. I don't think that we have any questions. Yeah, because this isn't one of those. Yeah, questions or comments, or ideas. And again, mindful of time. Could I share my experience in terms of are you talking about in terms of missionally, or what are you referring to?
How did you go into the community?
Into the community, yeah. I mean, really at Cornerstone, it's been primarily through workshops and trainings, as well as collaborating with the professional community. For example, I'll give one example. We held some workshops last year where this is kind of pre-COVID, where we had we have expat counselors, and in the morning, so we invited the Thai community. We had expat counselors speak, let's say, for example, on depression, and it was translated into Thai. And then there was a break for lunch, and in the afternoon, we invited one of the Thai psychiatrists from the local psychiatric hospital in the afternoon, who just spoke in Thai, and then allowed time for them to share about what does depression actually look like in a Thai context, because it's different, right? Us as expat counselors, it's very different. It might look different. How do people view depression? And there was time for question answer with this Thai psychiatrist. So we were able to give the community access to a professional that they wouldn't normally be able to talk with, to ask some really important questions about depression. And I would say that community workshop allowed people to meet one another. Oh, you have somebody that struggles with depression? My mom does, my daughter does, my son does. And it allowed them to feel that they weren't alone, which I think is so important. in this work of being missional in the work that we do. So that's one example that we do. And I'm seeing here that, how can you access the Cornerstone workshops? We actually have a Facebook group called Cornerstone Counseling Community Services. And I'm wondering if one of our Cornerstone people could share that link. I know there are a couple of you on those in the chat group with everybody, but it's called Cornerstone Counseling Community Services. And you can see examples of the kinds of workshops that we've offered to the community. And I'm glad, Vimbaish, I'm not sure if I've pronounced it, but that's neat to see that you're doing some partnership in Zimbabwe. Really neat. So I am going to wrap us up because I'm mindful that there are more things happening from here. So just thank you. Thank you for this time together. I hope more than anything that you are inspired to see your role as a counselor to be more than just a job, more than what you do in your office, but that you are an important part of God's kingdom and his gospel in the world through the healing that you do and that you offer and who you are as incarnational presence with those that you serve. So thank you for being with us. It's been a joy, and have a great rest of the conference.